I have been a loyal but fairly unpin-downable patron of Saving Faces for many years, but I'm really glad to be here today to say that even from afar, I've watched it grow and grow with its groundbreaking preventative work in schools to discourage activities like binge drinking. It can lead to facial injury, smoking. It can lead to mouth cancer. It set up the first ever national facial injury surveys to find better ways of managing these disfigurements, the first ever surgical mouth cancer study to discover what treatment works best in early stages of diagnosis, a national buddy patient helpline to support patients terrified about the treatment but reassured by patients who've already been there. The first ever electronic diagnostic service to help GPs and dentists to either settle patients' fears or, if necessary, speed them to the right specialist in their town. And this is absolutely brilliant, creating the world's first ever research center dedicated to this most socially sensitive part of our body, partnering 3 national specialty organizations which will collect major data and organize research to improve patient treatment worldwide. Well done, Saving Faces, even from afar, and the National Research Center. Keep going. Wish you enormous continued success. Thank you.
Firstly, it's a real pleasure to be here and to see so many of you here and such a mixed audience. And I would echo the fact that when we have patients in the room and their representatives and carers, it adds a richness that I think dispassionately now, having left medical practice and in managerial practice, one can see more and more often in the country. I think it's absolutely amazing what you're doing here, and Bruce would like to pass on his congratulations in setting up this centre and this collaboration between an amazing charity, and thank you very much, Alan, for leading that charity and being its patron, because it is, as you say, a very socially sensitive area. And I've thought, what would I add value to by being here today? I'm a humble GP by background, and I always say that because it usually gets a bit of a groan or a laugh, or a bit of inappropriate sort of pathos from it. But what I think you can add is that when you see people with either disfigurement that they're unfortunately born with, or with areas of damage through injury and trauma, and that's increasingly common, as Alan was saying, in this world of risk that we live in, and added risk by the behaviours that people have, it's very easy just to concentrate in practice on the problem in hand. I remember an old man who developed an oral cancer, and he presented late. I hope by what you're doing it will never present late again. But undoubtedly, his life was miserable. He required several episodes of surgery, radiotherapy, and he did not live a good death. And that stayed with me because the one thing that happened to him that changed him most was the fact that he could not leave home without feeling embarrassed. That the embarrassment was because he felt it was an eyesore and he didn't want other people to see it. And he felt embarrassed because it had an odour with it as well as a severe cancer. Now, those things are pretty rare these days, but it was seminal in my thinking about what I might add here today. And that is that when people come into my surgery, or came into my surgery with problems like this, one had to be very sensitive about what it was in life they wanted to achieve. Now, the current incumbent who's giving the Wreath Lectures this year is a guy called Atul Gawande, who's an oncological surgeon from the States in Boston. And he's written a lot of books around safety in medicine. But he's just written a book recently called Being Mortal, which I would recommend every single doctor and nurse reads in this country. It is an insight into what patients want from a service as opposed to what we think they want. Some of those things are goals that we would never think of as clinicians. They're social goals rather than clinical goals. And it's important that whatever research you do, and I see that in the agenda today, you've got quite an emphasis on psychological well-being, but that we approach the well-being of that patient as well as the underlying illness or disfigurement that they've been born with. Now, I think we've got a great chance in the modern NHS of doing that. But I think international research that you will lead through this research centre is absolutely paramount in defining good clinical practice. I see you have a debate later on today, which I'm afraid I can't be at, where you compare clinical versus scientific research and which is which is the better for improving. They're both as good as each other. They complement each other. But the third part of that is our qualitative studies that looks at the experience of the patient and what happens to them during the process. My cousin recently was diagnosed with cancer of the tongue. She was 52. I come from West Cumbria, where I used to practice, and it's a pretty close community, and I only have about 10 relatives there, so they're a very close family. She'd never drunk a drop in her life, and she doesn't smoke. And I said, how did you get cancer of the tongue? So, of course, there are other agents, there's other variants, and what it again taught me was, do not discount things because it doesn't fit into a pattern. Believe patients when they say there is something wrong and investigate it properly and take it seriously. Now, she had exemplary treatment, both physically and psychologically, and the support she got was absolutely excellent from her local hospital in North Cumbria and also from Newcastle. The third thing I'd like to just say is that I have a vested interest in you all doing this very well. My eldest daughter is an ENT surgeon. She's about 7 years into training at the moment. And I just think it's extraordinary what she comes home and tells me she does, because as a GP, I would never have done those things. But what she also tells me is a deficiency in the service for support, and we must get that right as well. I hope you have a wonderful day today. I hope I've added some value to your day, and I'll take back to Sir Bruce the enthusiasm that I'm sure I'll sense in the room as you go through the day. Thank you very much.